Welcome to the Dr.Sorin Show. This is Dr. Sorin and I'm delighted to have my old friend, Dr. Ramon Issa, here with me. Dr. Issa and I went to medical school together at Loma Linda. I just had my 20th year anniversary. I think this year is yours.
Yes, it is. That's great.
So, and then we're going to be talking today about a topic that should be very near and dear to everybody's heart. Everybody's focused on COVID, and COVID's awful, but people forget heart disease and diabetes. So this is a very, very important topic. So we're going to be talking about obesity, diabetes, and the state of health in America and how we can improve that. So we're excited. So just as we get started here, let's talk a little bit about your background. Just kind of establish your credentials.
Sure. So thanks for having me. It's great to be here again with you. I'm a family medicine physician. I did residency in family medicine, and I had a private practice for a few years, and then I kind of got discouraged with the family medicine, preventative medicine that I was trained to handle, and that I didn't feel like I was doing a good job on either preventing or treating, like what you said, of the chronic diseases, diabetes, obesity, metabolic syndrome, and these kind of things, and the effects of those: heart attacks, strokes, kidney failure, joint pains, heartburn, blood pressure, sleep apnea. These are kind of all related to this root of this lifestyle and diet. And I felt like I went to, I did residency for so many years, and was supposed to be able to make a big difference in these conditions and in these patients. And I didn't feel like I was able to do that. So I jumped in, I transitioned to doing emergency medicine, where I felt like I could, at least I felt like I was making an immediate difference. I knew that I could help somebody that's having pain. I can relieve the pain. If they're suffering, if their bone is broken, if they got an injury or an accident or a stroke or whatever it is, I felt like I could do something right away and I was making a difference. Whereas in the clinic prevention office, I didn't feel like I was doing what I was supposed to be doing, and there was this disconnect and this frustration.
So let's talk a little bit about your journey. Now, we've talked about this on the radio program before, but just very briefly, give us your journey with obesity and how you kind of ended up becoming so passionate about this.
Sure. So yeah, I'm not the same person today that I was 3 years ago.
You're two-thirds the man.
I'm 2/3 of the man I used to be. That's true. So yeah, I got up to over 308 pounds. I stopped checking at about 308. I didn't want to see it anymore. I knew it when I hit 300. The number I was supposed to weigh, that God wanted me to weigh, didn't start with a 3. So I could rationalize 299, but 300 was like, okay, now there's a problem. But so I was healthy though. I was an athlete, like I was telling you earlier. I was healthy. I was an athlete. Was not born with morbid obesity. I was not born with diabetes. I was not born with metabolic syndrome or fatty liver. Wasn't born with any of these things. So that was always in the back of my mind. But as life happened, and I went to medical school, gained weight, residency, gained a lot of weight, and then afterwards gained even more weight, and took directorship jobs, a little bit more stressful level jobs at Loma Linda University, where I did my medical school, and then I worked later on, and without knowing it, I kind of wandered into this morbid obesity, high blood pressure. I couldn't fit any of my suits. I felt terrible. My joints were hurting. I had heartburn all the time. I'd wake up tired and sleepy, snored all the time. You see, I had all these different things, but I never had these as an adult. Something happened in my body. So that's kind of where I got to.
Okay, so
to get.
So you were overweight, had heartburn, joint pains. Woke up not feeling rested again, sign of sleep apnea. Your blood pressure was going up.
Yes, that's correct. And so it took something very dramatic. I get asked all the time, so what happened? And so it wasn't just one thing, but it was multiple things. Like first, my suits stopped fitting. And I remember one time getting ready for work and getting dressed for a meeting, and I was trying to get suits that fit, and they didn't fit. And my wife was standing there. I was like, man, I need to get some new suits. And she's like, well, or maybe you can do something else. And I was like, something else? I'm like, people wear suits that fit. I mean, I need a new suit. And I thought my suits were shrinking, or I didn't know what it was. So my suits stopped fitting. I literally had no suits I could button or wear that were comfortable. And I'd already upgraded. This was the second time. This would have been the third time I'm getting bigger suits in my life, as an adult, obviously. And then I was Christmas caroling with the kids, and I stepped off a curb funny. I thought I broke my foot, and so I went to the urgent care that I worked at Loma Linda, and I was just going to get an X-ray, but the nurse was like, "No, you can't just do X-ray. You need to be checked in like a patient. You get your blood pressure and vitals." And I'm like, "Okay, whatever." And so they did, and the nurse checked, and her jaw dropped when she saw my blood pressure, and she turned the machine, and I looked at it, and it was like 175 over 100. And on the outside, I was like, I said, "Yeah, because I probably broke my foot." And you know, when
Because you're probably in pain. So
when you hurt and you're in pain, your blood pressure goes up. But in my mind, I was like, not that high. In my life, I always had been normal, even as an adult, 120s over 70s, normal. So what happened, you see? So, and then my dad passed away in April of 2017, and he passed away of the diseases that come from people that have obesity, diabetes, high blood pressure, sleep apnea, metabolic syndrome, fatty liver, all these things. He had stroke, heart attack, cancer, dementia, diabetes, all these different blood pressure. He's on all these medications and all these things, and then he passes away. And I'm watching him, and I'm taking care of him in the last days, and I'm thinking, I'm having the beginnings of what he has. The end. This is the end result of what I have, but. He's 77 years old. I'm only in my early 40s. There's no way I'm going to live another 30 some years when I'm already the way I'm at. Something has to be done.
so that kind of just clicked you.
I just knew, okay, I'm ready to do whatever it takes. I'm fed up, and something needs to be done. I don't know what it is, but Ramon's not going to, have the opportunity to, enjoy the kids and the grandkids, and I didn't want to be a burden on my family. Being sick, being this young, I knew it wasn't going to end well. But I thought, as a classically trained physician, I didn't know, honestly, we were taught that diabetes was not reversible. Once your pancreas, quote unquote, is dead and you're diabetic, it's like beating a dead horse. It never comes back. And people that are obese, 93%, 97 up to 97%, you lose the weight, it comes back within 2 years. You get your body resets, quote unquote, and you can never not be obese again. And we didn't have a drug or a treatment for fatty liver or for metabolic syndrome, quote unquote. There's no medication for it. And as a doctor, if there's no medication for something, there's no treatment, quote unquote, for it. You see. And so I thought, well, I'm stuck. This is where I'm at. I can never go back.
Right. So, and just I can't resist making just a little sidestep, but pharmaceutical industry does a lot of wonderful things. There's a lot of diseases that we don't even have to worry about today because we have pharmaceutical agents, infectious disease, even hepatitis C now. We can, cure that. So there's a lot of awesome things that come out, but it's a business, and business is driven by money, and there's no money in preventing diseases. Like the broccoli lobby is not sponsoring major pharmaceutical trials to show that eating broccoli every day is good for you. So although there's some literature shows that, it's really aimed at drugs, and drugs treat diseases. And so this is the exciting part to me about what if, and this is my passion, what if you didn't have to get sick, and what if you could use food, lifestyle, diet to prevent disease, so then you never have to be on the medications. It's great. It's like a parachute. It's like you want it there when you need it, but hopefully you don't have to use it.
Yep, exactly. I agree 100% with what you just said, and that's the message that's what I'm so passionate about is imagine thinking something is irreversible and you're going to just progressively and chronically get worse until you become disabled, have heart attacks and strokes and on medications and injections, and then you die, and that's your death sentence, okay? Then going from that to, hey, wait a second, I wasn't always obese. Were you always obese? Were you always diabetic? Did you always have fatty liver? Mm-hmm. No. So you were healthy at one point. Something happened. Now, hopefully, whatever happened is reversible, right? And I jokingly say, when I went through the mental process of, can I get better? I'm obese, I have fatty liver, metabolic syndrome, and I'm massively overweight. Something's wrong. I didn't know what it was. Well, I said, is it reversible? I said, well, was I always this way? No. Boom. So that's the first step. I wasn't born with these things that I'm suffering with as an adult. So that's the first start. Number two was did I wake up in a bathtub with a note on the wall with blood in the water that said you have 6 hours to get to the ER because you don't have a liver or a pancreas or a spleen? I didn't lose any of my organs. Nothing got surgically removed or traumatically injured or permanently damaged by a toxin, medication, injury, because that happens. If you get poisoned or something happens to you or you get in an accident and it hits an organ that helps you with these things, diabetes or whatever, yeah, it may not come back. Okay. Or if the disease has progressed so far that instead of just having diabetes, you maybe had a massive heart attack. Well, that part of the heart, that's irreversible. That can't be undone. Or a kidney that gets a little kidney stroke where a blood clot goes to the kidney and then that part of the kidney is damaged. That part of the kidney won't get better. But for the majority of people that I've talked to, a lot of the things that you're dealing with can be reversible. And so that's what I had to ask myself. Was I born this way? No. Okay, is there any permanent injury or damage? Well, I don't think so. And let's just say no. Okay, because if you think there's no turning back and it's irreversible, then you're right. It is, because you won't try. So you have to at least believe that it's reversible or partially reversible. And then you have to ask yourself what it was that made you sick and what kept you from getting sick.
And one of the I've helped with the depression recovery classes that we've done here at the Idaho Pain Clinic, but one of the excuse me, one of the things that hit me is sometimes you're told you have a disease. It's like you won the lottery in the wrong way. You lost the lottery and you're going to get this disease. When all of a sudden this knowledge that you have, this knowledge empowers you to where now you have control over your destiny. You're not just like on a roller coaster, you're just going wherever it takes you. You've got some control over your destiny, and that's empowering to people. Because now it's like you can make the choice of diabetes, of high blood pressure, and you did, because you were going down that path and kind of thinking, hey, this is inevitable, this is my fate, this is my doom, my dad ended up this way, I'm going to end up this way, and now all of a sudden, you've become empowered. Yeah. And again, that's my passion, of helping empower people. You can make a choice. We have freedom of choice. God gives us freedom of choice. And so you can make that choice whether you want to be sick or you want to be healthy.
Yeah, that's 100% true. So I always make sure that comes through, what life was like before and what it's like after, and knowing that you can make a difference, even if it's not. A lot of people, when we start having these conversations, they're like, well, I have this, I have that, I have this, my family, I have this, we have this thing and that thing, or I have to take this medication, or I have to do these things. And it's like, okay. But if you think it's not reversible, it's not, because you will not try. But at least consider maybe some of your symptoms or your conditions are reversible. And what if they're improvable? What if you have diabetes, you're on insulin injections and you're on pills? What if you can stop taking insulin, but you still take some pills? Well, you just got better. Maybe it's not reversed 100%, but it's like 85% reversed, and I don't have to stick my finger 4 times a day. I don't have to take shots. So, exactly. Okay, I'm sorry, you didn't not have diabetes, but it got a lot better, and you don't have to take shots. It's a game changing. That's so inspiring, because if you'd have talked to me, the doctor in the clinic, and it would have been 3 years ago, and you had diabetes and on pills and insulin, I would have said, I'm sorry, but you're always going to be on insulin, and you're always going to have diabetes. There's just your pancreas is done. It's given up. It's like flogging a dead horse, and once the beta cells that make insulin are gone, they're gone. They never come back. And we know that's absolutely not true. It's actually been proven. If you do the right thing that we're going to be talking about, the insulin levels will come up, or if they're too low because you're diabetic, the pancreas, the cells will start, your body will start making cells get bigger, and the balance of insulin and glucagon and blood sugars and things like that will improve and come back to normal in some people. So what if you're that some people where it can come back to normal and you can rejuvenate the pancreas that was quote unquote burned out? It's not burned out, it's dormant. It's doing what you've asked it to do because of how you're eating and living. You were just maybe given some bad information from Dr. Issa 3 years ago. So always freedom of choice. You have the choice, and you should, everything that I say and you say, you should make it make sense to you. Study it, test it, and check it out. Prove it to yourself.
Love it. We got to take a break, but we'll be right back. We're talking to Dr. Issa about healthful choices, diet, lifestyle, obesity, the major issues that are affecting America in public health. We'll be right back.